Hello, my name is Jacques Stroud, and I want to deliver better care to the homeless and underserved at lower costs and better outcomes. I don't want to make the service perfect, I just want to make it better than the status quo. Change. That word can have a positive or negative meaning, depending on your outlook. Disruptive, innovative, different, transform, variation, or modification. What does that word mean for you? DocFully wants to become the #1 resource for the homeless and underserved to receive health care outside of a hospital. We want to make our platform easily accessible and a trusted source for this community. There we go. DocFully came from my experience as an emergency medical technician, a certified nurse assistant for a nursing home, home health care advocate, and more recently, a volunteer at the San Diego Homeless Shelter. Here's where I met Waddell, a 58-year-old African-American with high blood pressure and a family history of multiple chronic conditions. He wants to see a doctor but can't because of his homelessness. He comes to the shelter for food and prayer but not health care, not yet. The homeless have a 3 to 6 times higher prevalence of developing a chronic condition than the general population. They lack access to health care. They want to see a doctor but can't because they have fear of leaving their belongings behind. So they end up in the ER, which is expensive, and they don't have the proper things in place to manage their chronic condition. Also, the physicians there aren't equipped to handle this population. Because of this, hospitals have the highest cost care setting. Average hospitalization in San Diego costs about $3,400. Technology is designed to help everyone, not just the privileged. Cephalus, our program, meets the needs of this population. A simple design to achieve one goal, to help the underserved get better outcomes. Our solution combines a person and a virtual exam, bringing primary care to where they are. How? We partner with doctors and send our staff to visit shelters to facilitate a telemedicine visit. The homeless gain access to primary care and improve outcomes at reduced costs. Now, we understand this competition in our approach to healthcare. With hospital emergency rooms and urgent care facilities, they help, but they are expensive. Some health plans offer telemedicine services, but the homeless don't have enough minutes on their phones to access this. There's fairly qualified health centers that can treat these populations, but the people still have to go to where they are, and that makes it difficult for them to receive health care. DocFully wants to create a change with these special populations by partnering with statewide organizations, and we want to innovate the approach to helping these populations. Our business model, we connect with doctors and hospitals and medical plans. We provide the platform and the person to work with medical professionals, and they are reimbursed through CMS codes. Not only does our service look to improve health outcomes, we want to create opportunities, jobs. In 5 years, we want to save the city of San Diego millions with reduced ER visits and hospitalizations. We want to give entry-level medical professionals an opportunity to start their medical career. We've already received $500,000 in funding from a grant. In 2020, we want to turn our pilot programs into customers and hire a sales force. In 2021, we want to improve our platform and scale outside of Southern California. In 2022, we want to move to Northern California and nearby markets. We built a diverse team of breadth and knowledge that's used to selling to and marketing to health plans, also working with doctors who are familiar with transition of care and working with the homeless. We also have experts that's FDA and HIPAA certified, familiar with the HIPAA regulations. In conclusion, change. What does it mean to you? There was an idea to bring together a group of remarkable people to make a difference in people's lives. We want to help people like Waddell achieve better health care by managing their care. We want to improve the lives of the homeless by improving their health care. We want to make our service available to everyone because no one's addressing this population. Thank you.
The 2019 Converge to Accelerate conference is brought to you by IEEE, the world's largest technical professional organization for the advancement of technology. Boehringer Ingelheim, passionately working to improve healthcare. NASCO, Advancing Digital Health Together. IPSI US, the Association of Independent Workers, for one, for all. Partners in Digital Health, publishers of the forward-reaching blockchain in Healthcare Today and Telehealth and Medicine Today. Special consideration to iWorker Innovations, taking the independent workforce to new heights. Connected Health Conference, designing for healthy habits and better outcomes. Haven Health Solutions, providing true blockchain transactional interoperability. Special thanks to Seaport World Trade Center for hosting us. We'll be right back after these messages. Don't go away.